Hello everyone, myself Chirag. I'm a student of M.Pharm Industrial Pharmacy. Today I'm here to discuss about the topic parenteral production. So first, let's start with introduction to parenterals. Now first of all, what do you actually mean by the term parenterals? Parenterals preparation are basically defined as sterilized mixtures with one or more active ingredients which are either injected, infused, or implanted into the body for administration. Parenterals basically include a large number of excipients, which includes solvents that are mainly responsible for enhancing of the solubility, suspending agents, buffering agents, along with compounds which are basically for making the medications isotonic with blood. Stabilizers, antimicrobial preservatives may actually be needed for the different parenteral productions. Now, these excipients which are included inside the parenterals should not cause any local irritation or any negative impact on the bioavailability, safety, or efficacy of those particular type of parenterals. Now we come on to the advantages and limitations of parenterals. Advantages, firstly, it is a rapid route of administration, gets dissolved inside human blood very easily. Avoids first pass metabolism, avoiding of the liver metabolism and deactivation by any gastrointestinal enzymes, because of which there is no interference by food or gastrointestinal enzymes. What are the limitations? It is intensive, expensive, requires sterilization and skilled person to inject. No weight in order to reverse the amount of drug administered following of zero order kinetics, little or no way to reverse any side effects. What are the different routes of administration of parenterals? Parenterals are basically having a four major important routes: intramuscular at 90-degree angles, subcutaneous at 45-degree angle, intravenous at 25-degree angle, and intradermal 10 to 15-degree angle, which is the most painful. Now, classification of parenterals. First of all, it is mainly classified into two major important classes: small volume parenterals and large volume parenterals. Small volume parenterals are having up the volume less than that of 100 ml, whereas LVPs are having up 101 to 1000 ml. Route of administration: intravenous, intramuscular, subcutaneous, whereas in LVPs it is mostly intravenous. Now these SVPs are mainly injected inside human body by the help of vein puncher, in which it is actually directly injected inside the veins of the human body. Whereas large volume parenterals, because the volume is large, that is why it is actually been injected inside the human body by the help of a process called to be as venicolysis. Now venicolysis is a process in which catheters or cannulas are actually being injected inside the human body, so that the large volume parenterals, because the volume is large, so at one time only it is actually injected directly into the vein so that it can be delivered directly. Buffers have to be used in SVPs, whereas in LVPs they are not needed. Isotonicity and pyrogenicity is also needed in small volume parenterals, but in large volume parenterals they are always must. And usage, if we talk about, small volume parenterals are mainly used for therapy and diagnosis, whereas large volume parenterals are used for detoxification and surgeries. Now, formulation aspects of parenterals. It actually includes a large number of agents, which includes therapeutic agents, which can be actually insulin, antibiotics, vaccines, analgesics, dextrose, antipyretics, the major important drug. Vehicles used: water for injection, sterile water for injection, or bacteriostatic water for injection, or other aqueous vehicles, which includes ethyl alcohol, PEG. Non-aqueous vehicles, which includes corn oil, peanut oil, coconut oil, etc. Next, we come on to antimicrobials, which includes thiomersal, benzethonium chloride, phenols and cresols. Antioxidants, for example, ascorbic acid, thiourea. Buffers, which are made for maintaining up the pH, acetic acid, benzoic acid. Bulking agents like lactose and mannitol. Chelating agents or the complexing agents, which is including disodium ED88 or tetrasodium EDTA. Protectants, for example, sucrose or lactose. Solubilizing agents to enhance the solubility, for example, PEG 300. Tonicity adjusting agents, which include sodium sulfate or sorbitol. And surfactants, which includes polyethylene or sorbital monoaleate. Now, what are the different type of vehicles used? First is water for injection. Now, water for injection is mainly prepared by the process of distillation or reverse osmosis, and it is chemically stored, and it is stored in a chemically resistant tank. According to US pharmacopoeia requirements, the pH has to be between 5 to 7, and it is a highly purified water which is used as vehicle for injectable preparations. Not required to be sterilized and pyrogen free at the time of use, and it should be used within 24 hours of collection. Whereas sterile water for injection is the water for injection which again goes for another stage of sterility after preparing water for injection. It is also water for injection packaged and then again undergoing the process of sterility. It is also used when relatively small quantities actually be needed and stored up in type 1 or type 2 type of classes, multiple dose containers not exceeding more than that of 30 ml. And it is permitted to contain higher levels of solid as compared to water for injection. Bacteriostatic water for injection is actually that particular sterile water for injection or water for injection along with 0.9% benzyl alcohol dissolved to dilute or dissolve up the drugs. It is mostly packaged up in single or multiple dose containers of type 1 or type 2 classes with volume not larger than that of 30 ml. Now, the overview of manufacturing process of parenteral production. First of all, we actually do the planning and scheduling, which includes equipment and facility, the documentation where all the procedures will be documented, the personnel who are the people involved in the process of parenteral production plant. Manufacturing requirements, then we do the bulk analysis, sterilization, aseptic filling, QC testing, visual inspection, finishing, labeling and packaging, and then we come on to warehousing. Now, what are the different type of WHO guidelines which have already been written down for a parenteral production plant? First is general considerations, quality assurance, hygiene, sterile preparation production, isolation, sterilization at the terminal, filtration-based process sanitation, isolator technology, technology for the blow-fill seal, employees location tools, and completing of the sterile goods. First, we come on to general considerations. In the case of general considerations, the entire process flow which mainly takes place in the case of parenteral production, clean spaces have to be kept up for the proper level of hygiene, and airflow should be actually a laminar airflow cabinets have to be maintained so that there is uniform flow of air through the efficient number of HEPA filters or the efficient filters which are mainly required for cleaning up the microbial contaminations. Within the clean area, district areas should always be there, which includes preparation area, aseptic filling area, quarantine area, packaging and finishing area, sterilization area, cleanup area, storage rooms. Next, we come on to quality assurance and quality control. All the samples which are actually being used for the parenteral products have to be filled aseptically, which includes containers which are actually being filled at starting and finishing of the batch, as well as following up any notable work stoppages. And during the process of quality assurance and quality control, special audits have to be performed in order to see whether the quality of all the different parenteral products is completely verified. Testing have to be performed to verify for the relevant products. Hygiene and sanitation. During the process of cleaning of the different type of equipments, validation is basically very important. Validation of the interactions between the different cleaning agents is always necessary, and different type of detergents and disinfectants are actually being used for microbial contamination. Different type of sporocidal agents may also be used in case any disinfecting agents are ineffective against the different type of spores. Next, we come on to sterilization. Sterilization has actually been accompanied by various processes, which can be heat sterilization, moist heat sterilization, radiation sterilization. One of the major important gas that has actually been used is ethylene oxide, which is a suitable gas that has actually been used as a sterilizing agent, or dry heat sterilization, moist heat sterilization, or ultraviolet light, which is not generally suitable for the process of sterilization agent, but ionization radiation is also being used. First, we come on to sterilization by heat. In this, there is a primary temperature probe and a secondary temperature probe, which are basically been maintained. Secondary temperature probe is actually been maintained ideally to compare the temperature which is actually been recorded by the primary probe at the coolest point of the loaded chamber, where the parenteral products are actually been completely loaded. Now we come on to sterilization by moist heat, in which both temperature and pressure variables are actually being noted down, and the temperature has to be recorded at this particular location for the duration of sterilization process for sterilizers at the bottom of the particular chamber, so that there is no fluctuations which are actually been brought in that particular temperature because there is presence of moisture. Now, sterilization by dry heat. In this, a large number of HEPA filters are actually being used, and this type of sterilization is actually been done for dry powders or non-aqueous liquids where there is no moisture involved. Several different type of HEPA filters are actually involved, high efficiency particulate air filters, which are actually needed in order to filter or capture the different type of microorganisms. Then we come on to sterilization by radiation, in which different type of gases and fumigants are actually being used. Fumigants are actually being mainly used, for example, hydrogen peroxide vapors or ethylene oxides are actually being used. Then we come on to isolator technology. Isolator technology is basically one of the major important cleaning devices which are actually been fitted inside the aseptic rooms for further removing of different type of microbes that may actually be present. During process validation, it must actually be shown that the different type of gases which are actually being used should have no negative impacts on the finished products, and the condition and duration of the degassing products are such that any leftover gases and reaction byproducts decrease the suitable limits. Now, one of the major important technology that is nowadays used for process of packaging is basically blow-fill seal technology. In this diagram, you can actually see, firstly, what happens, the plastic is actually being heated so that the parenteral production can actually start filling inside the hollow tube, which is actually acting as a perisson, after which the mold actually starts filling up the particular parenteral production inside the perisson, which has actually been gripped in the place. Then compressed air is actually been blown into the perisson, which actually starts inflating up the mold. And now the parenteral production actually starts filling inside the perisson mold. The product is actually been trimmed and removed from the particular mold, and the finished product of the particular parenteral is actually been completely ready. Now, next we come on to personnel. In cleaning areas or in the parenteral production, first of all the people who are actually involved should undergo complete training in subjects related to proper production of sterile goods, maintaining hygiene and fundamental microbiology. Employees should actually have already having knowledge related to microbial culturing, so that there is any presence of microbes which can actually be removed to prevent any contamination. The different type of premises which are actually being built, all the buildings which are actually being where the parenteral production is actually taking place, need to be built in such a way to prevent any needless entry of control or supervisory staff, to reduce the shedding or accumulation of the particles or microbes, and enable repeated use of cleaning agents and disinfectants which have to be always used. Now the premises, if we see, there is zone 1 which is exterior, zone 2 warehousing, zone 3 general production, zone 4 cleaning area, zone 5 weighing, mixing and transferring, zone 6 filling area, zone 7 is basically the filling line. First of all, we come on to working area. First of all, we are actually having up the quarantine area, where the incoming goods are actually been first of all stored in quarantine area, which is basically isolation. Then there is actually presence of a cold room also, where the temperature is actually been maintained, especially for the temperature sensitive products. Okay, and entrance is actually taking place into the warehouse, and then it is actually going from production area. The route of the final product is actually been separated from the incoming goods. Okay, the final products which are actually getting prepared and the incoming goods, both of which have to be separated, and there are several clothing and cleaning procedures also in the controlled transport zone. The ancillary area in the space provided for personnel where there is no production or storage. Now, first of all, we actually come on to warehousing. In the case of warehousing, we have to actually maintain a unidirectional airflow is actually being needed, and fully operating gowning procedure is actually being needed. Then we come on to preparation area. Preparation area is basically that particular area where the production of the sterile products will actually not completely take place, but it will actually start moving towards that preparation area once the aseptic and the sterilization process is done. Compounding area, the actual area where the process of manufacturing will actually start taking place, and how it will start taking place once the parenteral product is actually moving from grade C to grade B to grade A to maintain up unidirectional flow routes. These areas are actually been designed to minimize the microbial, pyrogen and particulate contamination. Then we have the aseptic filling rooms. Aseptic filling rooms, we are basically having up the presence of the corridors that are actually serving to interconnect to various rooms, fill rooms, airlocks and gowning rooms. Then we have the presence of aseptic storage rooms. Aseptic storage rooms are basically providing up airlocks, which are basically serving as transition points between one environment and the another environment. Now we come on to warehousing. In the case of warehousing, we are basically having up the receiving areas, which actually comprise of quarantine area upon arrival of the different type of products, sampling and unpackaging. And here all the incoming goods are actually been received, holded, which is basically the most fundamental function of the warehousing area. Then we have the wall and flow treatment, which is very important. In the different type of parenteral production areas, there should not be presence of any type of wall studs, bracing, pipes. The open flooring system is actually been frequently used for laminar airflow cabinets in the field of microelectronics, but it may not be used completely in case of parenterals. And in the case of parenteral production, there should be, the designer has to basically aim to remove any particular edges. That is why all the different edges are basically curved. Block filters have to be actually applied in the case of parenteral production to minimize up the level of microbial contamination. Epoxy paints have to be used, applied to the surfaces rather than that of the normal paints. And sometimes the sealed concretes, which are actually being needed in order to, which have to be applied over a healed concrete surface, it is usually not suitable for use in controlled areas for the parenteral filling plants. That is why in the case of parenteral filling plants, we are actually using the epoxy terrazzo, which has actually been applied on the concrete floors, along with polyvinyl sheets, which may also be present on the concrete base floor. Now we come on to lighting fixtures. Different type of lighting fixtures, or the different type of lighting bulbs which are actually being present, they have to be completely fitted and sealed with that of the ceiling rather than that of the hanging. Otherwise that can actually result up in presence of contamination. That is why we are basically having the presence of HEPA ceilings or HEPA filters which are actually been fitted with that of the ceilings. Changing rooms, restricted areas which are actually been only accessible by the personnel who are actually responsible for changing their gowns. In the case of changing areas, first of all, we are basically having up the presence of electrically interlocked doors, which basically prevent up the contamination. Then we are having up the presence of the wash basins for cleaning up the hands. Okay, then we are basically having up the presence of filter dryers, which are actually reducing up the production of the particulate matter production. Now this is how a change room basically looks like. First of all, there is basically entrance is actually taking place from this side. Then we are basically having up the hand wash. Then we are basically having up the hand dryers. After that, we are having up the clothing dispensers, the changing bench where the gowns are actually being changed, the gloves actually completely dispensed, and here the exit is actually taking place. Now we come on to personal flow. The personal flow, or the path which has actually been followed up by the person, have to be kept in mind so that they actually move from one zone to another, must be designed in such a way to reach areas with high degree of cleanliness or through locker rooms, change rooms and other spaces. Now the particular person should not be moving from the 1 to 2 or 3 to 2 or 3 to 4. Rather, there should be a unidirectional flow that should be maintained so that the particulate contamination can actually be decreased. Utilities and utility equipment location. If we talk about the different type of utilities, for example, transformers and switch gears are actually needed for electrical power systems. There should be treating water systems that should always be available in the case of parenteral production plant. Different type of steam boilers, compressors for airs and distillation systems are also being used as treating water system, transformers and switch gears. Along with this, the different type of heavy equipments which are actually being used in the case of parenteral production plant, they should not be located on second floor or first floor. Rather, they should always be located on the ground floor, because the vibrations which are actually being produced from the environment will eventually cause leaks. That is why usually a mezzanine device platforms are actually being used in order to solve up the issues of roof loading. Engineering and maintenance. In the case of engineering and maintenance, we are actually having up two major important terminologies. First is basically production maintenance, and second is actually called to be as plant maintenance. Now the different engineers who are actually working inside a parenteral production, they should have the access to the production area for the process of field. Production maintenance have to be basically provided and have to basically maintained so that the microbial contamination is completely removed during the process of parenteral production. And in the case of plant maintenance, we have to actually maintain up the plant in such a way so that there is no any malfunctioning of any different type of equipment which are actually being used for the process of formulation of the different type of parenterals. Next, we come on to what are the different type of containers used. First of all, we come on to ampules, which are actually being meant to use only once. Break the glass at this core surface. The product actually needs to be filtered before getting administered, because the glass particles could actually become loose during the process of ampule opening. Vials are actually having the presence of rubber stops and aluminum crimps, which are also being used in order to seal up the glass or plastic containers. Benefits are actually over that of the particular ampules, because if made with the bacteriostatic agents, they can actually be used in order to hold several doses. Then we are basically having a pre-filled syringes, which are actually been made in order to convenient and quick to assemble as possible. Okay, they can actually be used in the case of emergencies. The different type of equipments which are actually being used. First, we are actually coming on to syringe filling machines. So in the case of syringe filling machines, as you can see, there is actually presence of a conveyor belt, and then we are basically having the different type of fillers present over here, along with the in which the different type of syringes are actually being fitted upon. Now here the syringes are actually being attached. The solution is actually coming upon. The conveyor belt is actually moving in the right direction, which is actually resulting up in filling of the different type of syringes. The second picture actually shows up the ampule washing and sealing machines, where the different type of ampules are actually been stored over here. They're actually first of all getting washed with the different type of disinfectants, and then after that they're actually moving towards the conveyor belt, where the process of filling of the particular ampules is actually taking place, and then the process of sealing actually takes place in the case of ampule washing and filling machines. You can actually convert the manufacturing of an antibiotic ampule to an ampule, or vice versa, with just few principles. The machine parts includes transmission, ampule inlet, filling, stopper adding, ampule outlet, hopper frame. Then we come on to vial filling machines, which is also quite similar to that of ampule filling machines only. In the case of vial filling machines also, we are basically having up the presence of the conveyor belts, which are actually traveling and are responsible for filling of the different type of the vials. Now in the case of vials, these are actually moving from the conveyor belt to the filling stations, where the appropriate material has actually been added, and here multiple heads may actually be present in the filling stations. Once the vials are actually completely accurately filled, they're actually been moving to the following stations, where the stoppers are actually been applied on the vials, which are basically having an advantage over ampules. Thank you, everyone.